What brought me here to Palmdale Regional was via Lancaster Community Hospital. I came to the hospital as the executive assistant to the CEO.
I started off as dishwasher, then I moved up to food service worker, and then I went to patient ambassador. That's one that takes the orders for the patient, and now I'm supervisor.
I was just trying to get a job right out of nursing school, and the only thing that was available was flow pool, so I was here, there, and everywhere. Wound up on the med-surg floor.
First started in the ER night shift as a tech, and then was a graduate on the second floor, and then after a few years started taking relief charge roles, and then moved down to the surge ortho unit before it became their rehab unit.
That was the time when they were hiring out of the country or foreign nurses in 1990s because of there was not much RNs that time.
I started out in IT as the land administrator. It was back with Palmdale Regional of not having a lot of IT functions. So
I was here the day they broke ground, and something nobody thought we'd ever do. And it was exciting. It was thrilling to see the beginnings of what this hospital was going to be. I'd seen all the designs because I was in all the meetings taking minutes for all the different meetings, and so I kind of had an insider's view of what it was going to be like.
It was kind of like, I was very closed off. Like, this was my first job, so I didn't like talking to people. I was nervous. I stuttered when I got nervous, so I was like, please don't have me talking to people. So this job, I grew. I grew to now I'm more open. I talk to people like I'm way different than I was, and it's because of the job.
We had opened Lancaster Community Hospital. It was opened March 16, 1964. And we, of course, opened this hospital 12/11/10. We literally closed one and opened the other. And I closed the old hospital. And by that time, I had transferred over to communications. And I had to fight back tears, shutting down the switchboard. And the volunteer who opened the doors on March 16, 1964, she locked the doors for the final time. And it was quite moving. I mean, we were all crying, and then we looted it. You know, we knew they were going to tear the building down. So we took like the numbers off of significant rooms that meant something to us and things like that when I say looted the place.
I like moving to this bigger hospital, a bigger kitchen, a bigger, you know, and that's where I got my opportunity to be supervisor at this job because I felt I was ready.
And after I got my feet wet, being charge nurse, got a little bit of leadership under me, transferred 2004 down to surgery. And been in surgery since 2004 and transferred from the old hospital, as someone was call it, here to Palmdale. Been here the past 14 years.
It was my dream to see and work in the USA, in America. I know it's the land of honey and dreams fulfilled, so I was excited. And it never failed me. I'm thankful that I made it here.
sometimes you're out there striving for certain things, thinking you want something, but then when certain things just click and it works so well for you, you fall into your groove and you enjoy the job. And the majority of the people that I worked with at Lancaster Community, I still get to work with.
What makes me stay here is my coworkers. It's my coworkers. My coworkers are home. And I stay here with my coworkers, and we, I think, are a fantastic team, and we take care of patients.
So that's what gets me to come here, is the people. And those people push, because you work with older people, you work with younger people. So now I'm the older person that is guiding the younger people. So I took a different role. Before I was a younger person being guided, now I'm able to guide.
It's very gratifying to see we can do a job that not only the patient experiences, but you can tell a loved one that that the patient's doing really well. That's a very positive outcome, like I said, but a goal that we always try to achieve.
In the years I've been with this hospital, I have always been very proud to be here, and I take great pride in working here.
You come work at Palmdale Regional Medical Center. What's the very reason why I have stayed here for 30 plus years? It's the people. It's the people that matters. So there.